The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining today's webinar on how to monitor and troubleshoot the clinician experience across your EHR applications. By ways of introduction, my name is Stacy Leidwinger, and I am with the marketing department here at Goliath, and I have with me Yemi Lady Jew. He's our senior technical consultant. I wanted to do a few housekeeping before we jump in this afternoon. In terms of the agenda for today, walk through many of the challenges we hear from health systems like yourself when it comes to managing and supporting clinician experience across your virtualized infrastructure as well as your EHR applications. Throughout the session, if you have questions, please go ahead and submit them. We most likely will get to many of them at the end, but we will keep an eye out for them during the conversations today. And finally, one question we always get, can I have the recording? Yes, within the 24 hours, a copy of this recording will be sent to your inbox. So with that, let's go ahead and get started. In terms of the challenges that we often hear from health systems, especially with health IT, it really starts at this fundamental challenge where health IT departments have about 50% of the budget and headcount of their enterprise IT counterparts to support the same infrastructure in delivering that clinician workspace and that clinician experience. In addition to having less resources, the importance of supporting that experience is even higher in health IT, especially in today's society and world of everything that's going on. Because if a clinician cannot use the applications that are available to them, it can have a negative impact on patient care. And all of us who have even sat in a doctor's office probably has had this experience where a slow system is impacting your overall appointment. And this is even more critical today with telehealth. Telehealth is all delivered virtually. It's all delivered through applications. And if those applications are not working, that telehealth appointment is completely disrupted. And why is it so challenging to deliver that great experience? It's because over 20 different vendors need to come together in order to deliver that experience. And so when you think about what Goliath brings, and I'll talk a little bit more about this in a minute, we have purpose-built modules that can give visibility to health IT so they can see everything from how the end user is behaving, the infrastructure that is delivering Citrix or VMware Horizon desktops and workspaces and applications, as well as all major EHR applications, Meditech, Cerner, Allscripts, Epic. It's because we have business and technical relationships with all those providers, we serve as almost acting as 2 to 3 full-time troubleshooting experts on site. And what we do, why we can deliver that value to our clients, is because we help them overcome a lot of these challenges you see on the screen right now. When you don't have data to explain why there are issues and how there are issues, a lot of finger pointing can happen not only across IT teams, but with outside vendors. Often the way an issue resonates itself is someone calls into IT and says, Cerner is slow, Epic is slow, Meditech is slow, I can't get into my clinical applications. Just because that's how it manifests itself to the clinician or the medical staff does not mean that's the root cause of the issue. In fact, it's because of all those technologies that issue could be with the VDI infrastructure. It could be now, if someone's working remotely, their home Wi-Fi. It could be because of their endpoint machine, and the list goes on. So without proper data, solving those issues become extremely challenging. And the other big thing we hear about in a constant sore point with IT is they often aren't the first to know. They only know there's an issue because a clinician called in complaining, or someone on the medical team said my clinical application is down. Health IT wants to get ahead of these issues so they can prevent disruption for clinicians. And as I articulated, if we go to the next slide, why is it so challenging to come over these challenges? Well, it's just like I said, from an end user's perspective, everything resonates with the EHR application. I can't log in, it's slow, it's causing my other applications to drop, I can't connect to my peripheral devices. In the minds of the end user, it's a direct correlation between them accessing the EHR application. The reality, though, is there is over 20 different technologies that need to come together in order to deliver that workspace experience. So let's take a step back and explain what I mean there. When a user goes to log into their EHR application, you have your user. Each user is unique and different. How they work within their machine, what they do they have large files sitting in the background, an audio file running? That's all different. Where they're accessing from is different. Now you have more and more of your users remote logging into your network. Each of those, if your Citrix, is firing off a new ICA session. And then you have your different connection points. And what is the bandwidth on those connection points? How much bandwidth has been allocated to Citrix? This alone adds extreme variability into each individual session. Now you go into the data center, and there you have a number of other technologies coming together. You have all of your Citrix components from NetScaler gateway, storefront services, your DC. You also have your applications that you're portraying through Citrix or Horizon. Those include your EHR applications. You have your backend systems from licensing server to Active Directory. And then you have your hypervisor host layer, all often different vendors, different technology stacks. To add even greater complexity, I'm sure some of you today have this experience where different elements in your data center is in the cloud and some of it's on premise. And you're probably in flux where you're migrating more and more workloads to the cloud. Maybe you're even migrating to an EHR application that's hosted. So the amount of complexity in this environment is extreme. And that's why when there is a challenge and someone says, my login is slow to my EHR app today, you don't know, is it really the EHR app or is it an issue potentially at Active Directory? And if you don't have visibility into this, it can be a long time before you even isolate root cause and can drive resolution for your end users. And this is why you really need purpose-built tools that have embedded intelligence and automation in them that can go ahead and discover your entire IT infrastructure, identify what to monitor, and when to send alerts based on thresholds being exceeded. And you have to have that end-to-end visibility across all end user experience elements, your delivery stack, which could be Horizon, could be Citrix, elements of Microsoft in there, and then your EHR application itself. Why Goliath is a health IT standard is because we have purpose-built modules for all those major EHR applications, whether it be Epic, Cerner, Meditech, Allscripts. We have that embedded intelligence and automation so that we can discover your infrastructure and set alerts. And it's those logos you just saw, so if we flash the logo screen back up, each of these logos will tell you, because of the purpose-built module we have in healthcare, because of the technical and business relationships, because of the embedded intelligence and automation, we serve as acting as 2 to 3 full-time troubleshooting experts that can support their entire health IT staff. And we do that with our purpose-built technology. Next screen. And what our purpose-built technology offers is the ability for health IT to anticipate issues and resolve issues before end users are impacted, troubleshoot them quickly so we can give that visibility so that within 2 clicks you can isolate root cause and resolve issues, and then we document it. We provide data that can be shared, integrated, and enhanced with reports. And that data is allowing organizations and health IT staff to prove to management, prove to other vendors, prove to end users what the root cause was and that a permanent fix solution is put into place. When our customers that you saw a slide before implemented, they truly transformed their entire health IT organization from reactive to proactive. With that now, let's go ahead and jump into some user stories and the technology. I always think it's great to really understand what does that mean by going back to clients. So let's talk about the anticipate. I'm going to tell a story about Universal Health Services. They came to us because they had a number of issues where their customers were complaining, not customers, their clinicians, their end users, were complaining because their EHR application was slow. They happened to be using Cerner. They were saying Citrix is slow. They had applications like Dragon Dictation crashing, and there was a lot of finger pointing going on. And they tried to resolve this manually. They had IT staff going to their individual hospitals, and logging in on site at 4 in the morning, 5 in the morning, trying to determine and make sure that all applications were performing well and that they were readily available. But as you can imagine, manual intervention doesn't always work. And they weren't always able to identify issues. And issues can pop up not just first thing in the morning, but throughout the day. And so they needed to ensure that their clinicians always had access to their EHR applications. And when there was an issue, be able to isolate root cause quickly. And so they turned to Goliath. And with Goliath, we implemented a solution that allowed them to go out and test application availability. They tested it through Citrix, Horizon, making sure that those environments, they were a Citrix customer, were readily available, making sure Cerner was available. And they ran those tests across multiple locations, and they continually ran those tests throughout the day, alerting anytime an issue was found. Because of this, they are able to prevent outages, they're able to prevent slowness, and ultimately deliver better patient care. Yemi, do you want to walk through the technology to show how they did this?
Absolutely. And before we get into the technology, I just wanted to set the stage a little bit and talk about how this technology is deployed. So, as Stacy mentioned, Universal Health Services is they leverage Cerner as their primary EHR application, and Cerner RHO, meaning that it's a completely hosted application within Cerner's data center. So how they have the technology deployed is they have technology deployed in Cerner RHO for monitoring and troubleshooting. They have a central Goliath server that's deployed in their data center. And then they have lightweight pieces of technology that's deployed on a laptop or workstation or virtual machine at each of their different acute care hospital locations. And from those locations, that lightweight technology is essentially logging on and launching Cerner applications, making sure that those applications are up and running on a 24/7 basis, testing the Cerner applications, and of course reporting back to the Goliath central Goliath console in their data center. So to give you some perspective as to what's actually happening at that specific location, I have a quick video here showing the technology actually launching a Cerner session. So from that location, you can see here, it's able to open up a web browser to the NetScaler or storefront page. It's able to log in the same way an end user would. It can accept security statements, ELAs, things like that. It can confirm that the storefront page loads, navigate if the storefront page if needed, and then start launching these Cerner Millennium applications. So you can see here, FirstNet, it's going to go over to PowerChart. And this is happening 24/7. There's no you don't have to sit there and watch this happen, right? This is something that's happening from those different locations. And if there's an issue with any of those, you now get a real-time alert and the ability to analyze each one of those launches from this page within the technology in that central console, which is called the Application Availability Analysis tab. So really quickly, this page is broken down into two sections. You have the top section, which is a high-level dashboard of all of the launches taking place across the environment. The blue bars represent the launch times of these applications, and then the trend line here is going to represent overall availability. So out of 100%, how available are these applications that we are launching from those different locations? And you can see at the top of the screen here, you can filter based on the date range, right? So if you wanted to go back and see what availability looked like over the last week or month, you have the ability to sort of configure that and then export this data out, of course. You have the ability to filter based on locations that you're launching applications. So in Universal Health Services example, they would be able to filter based on the different locations, the different acute care hospital locations that they're launching applications from. And then also you can filter based on the application. So this is where you would filter, let's say, PowerChart or FirstNet, SA Anesthesia. You can also look here at the bottom of the screen, and this is where you would go if you have received an alert from the technology that one of these launches have failed. Then you can see, of course, the date and time of the launch here on the left. You can see the applications that were being launched. And again, this is where you would see those applications in the Cerner Millennium Suite. You would see the locations that they're launched from, what session host actually was involved in delivering that session. And of course, you can see exactly at what stage it failed, and even drill into it to show screenshots of each step of the process. So essentially, everything we saw in that video is represented at the different stages here with screenshots. So essentially, UHS is getting not only an early warning system, but screenshots so that they're getting out of the business of relying on users to report issues and describe issues. Here you have the screenshot so you can see exactly what error message would present to the users in that particular case. Universal Health Services has been able to identify issues with applications not enumerating correctly, or specific areas, or they had a specific hospital that had oversaturated Wi-Fi access points that they were able to leverage this technology to identify quickly and solve and limit the user impact altogether. And so before we move on into some other proactive portions of the technology, I did want to show specifically, because of course, we don't have a live Cerner environment here, but I did want to show a screenshot of one of the application launches here from a live Cerner environment, where you're able to see all of the applications that are being launched here. So FirstNet, SurgiNet, PowerChart, and you can see exactly the screenshots and the error messages that present when there is a failure, so IT can get ahead of them and solve them and limit end user impact altogether. Another sort of proactive portion, and again, taking IT from being a reactive organization to being more proactive, is the ability of the technology to discover the environment and then deploy monitoring rules, intelligent sort of rules to the environment to allow you to identify issues that could present a poor experience to users. And that is really evident in this view here, which is our Citrix automatic discovery and dependency map view. And as soon as kind of the name implies, this will automatically discover the components or elements in the environment that are sort of associated with the delivery infrastructure. It's going to map them out here. It's then going to add over 250 monitoring rules to the environment. It's going to be monitoring for conditions, failure points, thresholds, and events that can actually cause end user experience issues if they're not taken care of. These monitoring rules then drive a number of screens in the technology, so that at any point in time, you're also, of course, getting these alerts, but you're able to see exactly which components might be causing end user experience issues in your environment. So if you're looking at this screen here, first of all, at the top left-hand side of the screen, you have the ability to toggle between the different data centers or Citrix sites that you have. So for instance, a lot of our healthcare customers would have active or active passive environments for disaster recovery. So you can actually toggle between each of these sites, still leveraging the embedded intelligence for each one of them. We'll talk a little bit about the different views that this presents. However, sticking with this one, which is the infrastructure or sort of physical view, you're able to see from left to right the NetScalers, the storefront servers, delivery controllers, as well as any supporting IT infrastructure that are sort of involved in the delivery of Citrix in your environment. And you can see, here's where you would see things like your domain controllers, licensing servers, PBS servers. And as you click on the individual components, on the right-hand side of the screen, you can see resource utilization, context-specific health checks based on the role of the component in the environment, and even any alerts. So if there are issues with, let's say, connection failures, resource utilization problems, you can quickly identify them here, solve them before users are actually impacted. You can also, of course, drill into the delivery layer, where you're able to see a logical view of the environment. And again, all of this is powered by embedded intelligence and automation. So as you click on a specific delivery group, what you'll be able to see is user experience metrics for the entire delivery group, as well as the embedded intelligence pointing you to specific components that might be negatively impacting the user experience. So you can see here on the right-hand side, end user experience metrics per your hypervisor host, per your hypervisor cluster. And if there are issues that are negatively impacting the experience, you are aware of them before users start calling in. So with that, I'll pass it back over to Stacy so we could talk about the next customer achievement story.
Great, thank you, Yemi. In terms of our next story, remember I talked about the criteria for a purpose-built tool. Yemi just walked through how we can anticipate issues, and he highlighted with the automatic discovery map what I was articulating around embedded intelligence and automation. As we move forward now, I want to focus our stories on the troubleshooting aspect. You're trying to troubleshoot around logon initiation, logon durations, session performance. Those are our 3 issues that come up time and time again for health IT. Well, this is an example for a large Midwest health system, and they were really struggling because their end users were complaining that Epic was slow, and it was taking them over 2 minutes to log in. As you can imagine, there was a lot of finger pointing. Was the root cause because of Epic? Was the root cause because of the environment, Citrix, that they were going ahead and throwing it into? Was it because of the clinicians? Was it because of the endpoints? No one could really identify why these logon times were so high. And as they tried to identify root cause, clinicians and medical staff were just getting more and more frustrated. What we were able to do is go in with Goliath, and Yemi's going to show this in a minute, and in a single screen, show every potential IT element that could impact that clinician experience, give visibility into what was going on, prove that yes, in fact, these users are seeing slow logon times. Here in the logon process is where the issue is, and the root cause for a lot of their issues ended up being in their group policy setting. They were able to solve these issues in less than a minute once they had the technology that gave them the visibility they needed. Yemi, will you go ahead and show how the technology resonates and how our health system customers use it in order to troubleshoot and resolve performance issues quickly?
Absolutely. Yeah, so let's take, for instance, in this particular case, right? I'm a, IT admin or, a Citrix admin, and I get a call from a user saying, my session is slow or my logon time is slow, similar to this particular case here. Where I would jump to in the technology is going to be the screen that I have up now, which is the Citrix virtual apps and desktop session display. And this is where all of those sessions in the environment will automatically populate. So here I can see the users, I can see, of course, how they're connecting into the environment. I can, go back and take a look at historic sessions. So, right now I'm showing sessions for the last 4 days, but I can go back months, weeks, and still get the same amount of data within that user session as I would from a session from today. I would get that sort of same data for a session from 2 months ago or 3 months ago, which essentially gives IT the ability to say, what has changed in the environment over the last 2 months that might not have been causing an issue back then, but is causing an issue now. But let's take, for instance, I have a user called in. I can search for the user with the quick filter. I can filter based on any one of these tabs here. Once I've identified that user session, I can click down on the session. And what I'm now going to get is a pop-up showing me everything that affected this user session. So down, starting from the users and broken down in a single view. So by the time I can traverse through this view, I can emerge with an answer as to why slowness was taking place, or why, in this case, there was a high logon time. So of course, I can look here and see a specific user. I can see what components were involved in their session. I can see some performance metrics, but in this case, we're going to jump over to the logon tab here, because this is going to detail each stage of the logon process, and with more detail than is in any other tool that's out there, so that you can quickly pinpoint exactly where the slowness is coming from. So if we look on this page at the top of the screen here, you can see what's going on during the brokering stages of the process. So this is, and it's segmented between, on the left, you're able to see what's going on, the sort of the delivery controller stages. How I like to think about it is what's happening within your data center. And then you can also see what's going on at the client session or the client side with Citrix Receiver or Workspace app. And this is without deploying any technology to the user's endpoint location. You're able to see things like how long ICA file download took, or how long it took to establish the micro VPN connection. How long did it take for Workspace app or Receiver to go through its startup processes? Now, in this case, with this health system, they were running into issues specifically with users logging in with group policies. And then, in some tools, they would just say group policies were sort of high. But with our technology, they're able to look at the bottom section here and expand the different sections that have additional stages. So for instance, in authentication, they're able to take a look at what OUs this user is a part of and what domain controller was in charge of authenticating the session, how long it took for LDAP calls to take place, and even down to what files were being accessed during this user's authentication process. And in group policies, this is where they found their issue. Because our technology is going to show you exactly which group policies are affecting this user session, down to the policy name and how long each one of these policies were taking to execute in the environment, what they found was that there was a really long time in their drive mapping policy, which they are able to explicitly see here. And it turns out that they were actually mapping sessions to a drive that was decommissioned, right? So they were able to quickly solve that, remove that policy, and cut down their logon times by about 90%. Without this sort of visibility, they were spending much of their time sort of drilling, trying to look at all of their different consoles and different tools, maybe spinning up new users and trying to add policies one by one. But when you think about it, they're a health system, so a lot of policies are affecting different users. So it's taking a lot of their time. This gave them the ability to quickly pinpoint exactly what policy they needed to be looking at, so they can solve that and ultimately deliver a better experience to the users. So this health system was delivering Epic via Citrix. And that's the one piece, right, where you're able to troubleshoot everything that goes into the delivery of that application, right? Because you can head back over to the summary tab and drill into what's affecting the performance of the environment, whether it's, they're having latency inside of their Epic applications and things like that. But what they're also able to do is, in the same single console, understand the application performance as well. So we actually have a technical partnership with Epic. We're a member of their App Orchard program, which means we actually have the ability to pull into the same console the application performance for those Epic sessions as well. So I'm just going to flip right over to the Epic Sandbox environment that we get access to because we are a partner. And you can see in the same console, IT is then able to take a look at the activity, the workflow activity. So essentially the session counts and how much data is being sort of leveraged in the Epic environment. But also you're able to take a look at the latency. So how customers use this is when there's an influx of tickets, it's really important to understand where the problems are and where the problems are not. So essentially, IT is able to use this, and this health system, for instance, is able to use this to say, okay, there are issues coming in. Is it an Epic problem, or is it a sort of problem with the delivery of Epic, which in this case would have been Citrix? So they would take a look at here and see, are we seeing latency? Are we seeing activity that is way more than we can support at these certain times? And from there, they can make a decision on whether to escalate over to the application team or to drill into those user sessions using the session display screen that we previously were on to understand exactly what's impacting that user from a delivery infrastructure perspective. So with that, I'll pass it over to Stacy. We could talk about the next success, the next client achievement story.
So the next stage that we talked about now that we've gone through troubleshoot is document. And I always like to say data is king. As soon as you start having data, you can start driving to conclusions and you can foster collaboration across teams. Here's an example where this was a children's hospital and they too were experiencing long log-on times. And what management said, if we're going to invest in a new VDI upgrade, I want proof that it is having the impact that we said it would have and justify that spend. And so they leveraged Goliath technology to measure the initial logons, proving that in fact over time, they often were 90 to 120 seconds that users were experiencing. There was a large number of users that were experiencing logon times even above that. And then once they upgraded their VDI, they leveraged Goliath to now baseline. And using the reports that were out of the box, they were able to show that their logon times were well below their goal of 30 seconds. In fact, often were as low as 12 or 13 seconds. They also showed their goal was to have 10-second reconnect times. They proved through the reports that reconnects were often sub 5 seconds. And so based on these reports, they now can go to management on a weekly, monthly, even yearly basis and track and say, look, that problem we have solved it. In fact, when I spoke with this customer, they made a comment that they have eliminated end user dissatisfaction. And if I said, well, how do you know that? Well, by creating these reports and being able to produce them and show them, they absolutely are proving, look, we have the times we need. The other thing they're able to do now that they have the ability to get the data and document these key performance metrics is they can look for the outliers. There will always be issues. As we said early on, end users have unique ways they interact. How they connect are different. And so they're also using this data and able to document and see our users that are on site at our hospitals, here's where their average logon times are. Here's where our remote users are. We found some of our remote users have very high logon times, but we're able to use the evidence that we have within Goliath to show it's not because of the system, it's because of their home Wi-Fi network. So having this data drives collaboration, not only among IT, but with management, other vendors, and IT users. Yemi, do you want to talk a little bit about the data that we can help with provide to organizations?
Yeah, absolutely. And Stacy, to your point, this was one of the reports that they were able to leverage to show exactly to show management exactly how the environment is improved over a specific time period. So this is our Citrix Virtual Apps session logon duration report, and you can see that this is going to break down the users here on the left-hand side of the screen. It's going to break down their overall logon time. It shows you specifically if this was a reconnected session. And then it breaks down their logon times as well as the different stages of that user's logon, so that you can see exactly where IT needs to focus their efforts on, or to show, of course, historically the differences and the improvements within those different sections, as they have added different technologies or changed policies around in order to deliver a better experience to the end users. So this is one of the sort of out of the box of reports that a lot of our customers leverage just to get the data and to prove and to show some things, the improvements in the environment. This next report is more sort of management focused, and this is one that allows you to sort of trend out the information that we're collecting. So this customer actually wanted to segment out logon times based on the delivery groups, leveraging third-party reporting tools like Power BI in this case. So this is one where they were able to show the average logon time per delivery group, but also at the bottom of the screen here, you can see that they still had this granular detail into showing the different stages of the process and how long each stage or how much each stage actually affected the overall logon time as a whole. This is one that they were able to send over to management because it's of course very visually appealing, but it also allows them to show the trends over time as well. And here's another one as well that breaks down, and this is one that we got from one of our Cerner customers. This is one that breaks down here at the top of the screen, the different stages of the process, tracked with overall logon time over a specific time period. I think this was about a week period. But you could also see the logon times per application as well, which again allows them to identify what applications need to be focused on. And as you can see here, they were able to show management that they had sub 15-second logon times for all of their applications that they were delivering via Citrix, which of course was very, very helpful to them in that particular case. So with that, I'll pass it over to Stacy and we can wrap up.
All right, thanks, Yemi. In terms of questions, we have a few coming in, so please do send any additional ones that you have. One question we always get is, well, how long does this take to implement? We have helped the health systems get up and running in less than 2 hours. We have a white glove implementation service to help you install everything. You work with our technical consultant like Yemi to get out of the box reports and alerts functioning set up. And then again, I keep harping on this because it's so critical. Our product does a lot of the work for you. It is the embedded intelligence and automation that will discover your entire environment. We identify what to monitor, and then we know exactly which alerts to send based on when thresholds are exceeded. And the fact for health systems, we do this with purpose-built modules for all the major EHR systems, Epic, Cerner, Meditech, and Allscripts. That's what allows you to get up and running quickly and be effective almost instantaneously. So with that, let's go ahead and jump into the questions. Yemi, one of the first questions is, how are you different from Citrix Director?
Yeah, that's a good question. And that's something that we typically get a lot. So I actually have a slide prepared that can sort of illustrate a little bit the differences between our technology and some of the other tools that are out there. And it really is about visibility. So if you look in the middle of the screen here, all of these components that are not red are actually what Director is going to monitor. And we actually got this from Citrix's website themselves. But you can see here that Director is going to, do a good job of monitoring those specific Citrix elements that impact the environment. However, as we all know, there are a bunch of other things that go into the delivery and into the delivery of Citrix and user experience that are outside of what necessarily would be called the Citrix stack. So everything on the screen here is what Goliath is going to monitor. It's going to give you visibility into the endpoint locations, into the networks, into those back-end systems that are interacting with the Citrix environment. It's going to give you visibility into the hypervisor host so that if there is an issue with any stage of the process or any component that impacts user experience, you're able to see that, to troubleshoot that, and then to be proactively alerted on some of those things as well. Another thing that sort of is a big difference would be the historical retention of data, as well as the ability to document data moving forward so that you can drive permanent fix actions with objective data.
Great, thank you, Yemi. Next question that came about, do you have any reports that document activity for remote workers?
Oh, absolutely. Yeah, and as you can imagine, within sort of the climate that we're in today, where most people are working from home, it is important for IT to get a visibility into how users are working in the environment and what has this sort of remote workspace shift. How has that affected users' productivity? So what I actually have here on the screen is our end user productivity report that we created for our customers to be able to determine, how users are working in the environment. And of course, a lot of our customers will leverage this to understand, okay, are users actually working when they're working from home? But a lot of times, this is heavily used to try to get an understanding as to when users start to log in now, right? Because they're going to be homeschooling or, working with, they have home duties and things like that. So essentially, you can then identify, those times where a lot of users are on the environment actually working. And also, we've had customers that leverage this data in conjunction with our data on user experience to determine how user experience is actually affecting productivity. Whenever user experience is poor, do we see an impact in productivity, so that we can sort of decide on what things we need to do to change the environment to deliver a better experience to the user. So to answer your question, yes, we do have reports on productivity showing you essentially how users are working. And before I sort of hand it back to Stacy, I did want to talk a little bit about what is presenting here in this on this report. You can see, of course, the users' names on the left-hand side of the screen, how they are connecting into the environment, whether it's through their NetScaler, storefronts, things like that. You can see the duration of their session right here in the middle, the amount of time that they're spending interacting with the session, so actually creating ICA traffic. Conversely, you'll see the amount of time that they're not using the environment. There's not any ICA traffic taking place. You can see interaction percentage, a max inactivity time to show the maximum amount of time that the user concurrently was inactive within their session. So you can see if maybe they took a break for an hour or 4 hours or something like that. And essentially, finally, you can see what applications they were leveraging inside of their session as well.
Great, thank you, Yemi. We have another question here. Can you identify if an issue is due to the home internet or Wi-Fi versus the internal infrastructure?
Yes, absolutely. And that is exactly how a lot of our customers are able to troubleshoot issues with user experience. So within our session display, and I'll flip back over to that just to give you some context here. Within our session display, we go back to that session that we were on. Here is where you'll be able to identify that, and it's very, very simple, right? So in this case, we can see this user has a high round trip time. In round trip time, of course, tells you whether or not a user is experiencing issues or not within their session. We also break open network latency, which tells you how much of that round trip time is actually being impacted by the network performance. And this is real-time network latency. It's not a ping-based or ICMP based or test package or something like that. This is actually something that we're getting from the ICA protocol itself, because the ICA protocol is measuring this information to determine how it's going to respond, in cache, to be able to support the user's session. And then finally here, you can see the connection speed. And this is the amount of bandwidth available for Citrix Receiver Workspace app at the user's location. So wherever this user is located, whether it's their home office, whether it's a Starbucks, whether it's someone connecting in on the road using a mobile hotspot, you're able to tell how much connection or download speed this user has at that location. So if it is a home Wi-Fi issue, right, where the user, and this is a home user here, and you can see specifically this user has really poor connection speed. It's about 0.5 megabits per second. So this sort of session, you would expect to see a lot of round trip time issues and latency. But you have the objective data to say, yes, you are on a 0.5 megabit connection. That's why you're having issues. It's not an issue with Citrix. It's something going on at your home location if they're using Wi-Fi or something like that.
Great, thanks, Yemi. Next question, if we use Cerner hosted and we have VMware internal for VDI, can you support our environment?
Yeah, absolutely. That's sort of the double hop configuration where you have VMware or Citrix on premises, and then you're leveraging Citrix inside of that session to access the sort of hosted application. And the answer is yes. Yeah, you'll be able to see both sessions and the latency within both sessions, and again the connection speed metric as well, so that you can determine if there is an issue, where that issue is taking place. Is it within the application, accessing the application, or accessing the desktop from the different locations that the users would leverage those tools from? So the answer to that is absolutely, whether that is Citrix or VMware Horizon on premises.
Perfect. Next question, do you integrate with Imprivata?
Yeah, that's a good question. So, of course, the Imprivata is very, very prevalent in healthcare. We actually have customers, for instance, in a Cerner environment, because we are the only technology that's deployed in Cerner's remote hosted locations and facilities, as well as, of course, customers that leverage Imprivata and other tools like that on premises. We actually have the ability with our lightweight intelligent agent to monitor some of the processes that take place, monitor those services on those machines as well. So if there's an issue, there's errors, there's processes running hot that could be negatively impacting user experience and the user's ability to access these environments, we're able to not only monitor and alert you to those, but we can track and trend those things over time as well, and of course give you visibility into that for troubleshooting, all aligned to the user session. So that is something that we have a lot of customers leveraging our technology, whether it's within a hosted application like Cerner or on premises like Cerner, or excuse me, like Epic or Meditech or Allscripts. A lot of our customers are leveraging our technology to monitor those sort of pieces as well.
Great. And one last question, unless anyone else has any to submit, is if I need to show report baselining Logon performance for 8 weeks, can you do that?
Absolutely. Yeah, we give you the ability to choose how long you want to keep your data for in the technology. So we have customers that are holding on to data for 180 days or even longer. So you can sort of pull on-demand reports, or we have customers that don't want to keep data for very longer than a month, but they are able to run reports every month that will give them that sort of visibility. So it's really very configurable, and the historical retention and the reporting and the ability to share and export data on an ongoing basis really allows you to do whatever you would like with that data, whether that's trending, log-on times, latency, so on and so forth.
Well, great, Yemi. No additional questions came in. So I would like to thank everyone for attending today. If you do have any questions, or if you'd like to see a demo, or if you would like a free trial, please email techinfo@goliathtechnologies.com and we'll be follow up. Thank you, everyone. Have a great day.